Alrighty.
Are you sure? Yeah. You're back there all by yourself? Yeah. I see. Well, you have these people. That she had come to see me, and I wasn't there.
Mhm.
Let's
Okay,
move on to the
that's it. Okay.
Just a quick reminder about the Q and A, the participants are going to have to speak into the microphone.
Yes,
So I can just pass.
okay.
Yeah.
Good,
And if there's
thanks.
any issues, I'll just sit right there.
Good. So, good afternoon. I hear we have to listen whilst eating. In where I come from in Ghana, hardly do you mix the two. Because when you are a child, they tell you that if you are eating and you talk, your mother will die. And the kind of food that we eat with a lot of soup, that is the way to get you out of the danger. That is it. So this afternoon, we're going to go to a very interesting presentation. I'll just do the introduction, and the doers will come and talk about how they did it, because I call it the magic of the water world in Ghana. For many years, we've been talking way since independence about policies and strategies and plans and everything about water. We declared water for all as way back as the year 2000, but we went nowhere near it because we ended up still having about 60% of Ghanaians who did not have access to water. And in the rural areas, they were worse. We had attempted so many plans, including a very huge World Bank investment in the 1998 in the rural areas to provide basically a borehole for every community. But it lasted for just a few years because nobody thought about how they were going to maintain these boreholes. In the urban areas, the same. You saw people digging trenches for many weeks. They finished, supplied the water for some of the communities that were lucky, but many of them became dry pipes just after 5 years because we couldn't finance it, we couldn't maintain it, and the strategy just involved providing the facility and the infrastructure without thinking about how it was going to be managed. So in very hard times, when government is broke, the easier thing to do is to forget about these services and providing maintenance for them. Institutions after institutions, policy after policies, we never got it done. So when it came around that another strategy was drawn and was lying there, two institutions were supposed to do that, the Ghana Water Company and the Community Water and Sanitation Agency. Numerous other civil society groups and NGOs and development partners were doing it, basically concentrating in the northern part of the country. But the same thing was going to come out because nobody had thought about maintaining it after providing the facility, especially for these rural areas and the peri-urban communities and those new areas who were just being introduced to clean water. But some people ventured. They asked the question, why? Why is everybody trying to do something without connecting? Because everybody was creating a space for him or herself. Institutions were doing the same without thinking about how we could work together to get the full chain done. There was a response somehow from IRC, not in Accra, not in Tamale, not in Kumasi. Could have been easier, not in Secondary Takrade. But way up there, in one of the most forested areas in the country, where the nearest tarred road to the place was just about 30 kilometers. It tells you how far away it was from civilization. But they dared. Because at that very time, these communities were going through very, very difficult times, in the sense that there was a huge mining concession granted, and many communities were struggling with the running water which they depended on, being challenged by these new mining investments. Again, there was somehow leadership coming up, because then the district assembly itself was struggling, engaging the private sector so many times, and yet the response wasn't coming. So there was a need to galvanize more action. civil society groups, communities. The government itself saw the need for it. The private sector encouraged that if you're about to do something, we might look at you. But IRC did. Began talking to the communities around and all these parties. And today, we call it the magic of the water sector in Ghana. 85% of the population have access to water. But in this community, they say that it is not just the figures. They really mean it, that by the end of 2030, every single person, that was the goal established by the community, should have safe access to sanitation and also safe access to water, access to safe water. This is it. If this is a story, the creators are here. The regional minister who has the vision. We also have the country director for IRC. She's also here. That's all through that something could be done. The people on the ground, Jerry and Co, who supported this process, the regional plan officer, the regional coordinating director, and our good friends. Aqua is here. Safe Water, I can see them. They are here in this room. And then also Necentric, which also brought in that element of communication we never thought of. We also have other partners who also brought the pace to push this idea forward. The Conrad Hilton Foundation is also here. Community Water is here. Sanitation Agency, Ghana Water is also here. But the story will be told by them. And therefore, I open it a big opportunity for all of us, starting from the regional minister who has the vision. What happened? What did he think about? Why was it that nobody was doing it? Nobody thought about it beyond just providing the facility. He thought that he could do something for his people. The IRC country director will also join him to tell her the story. What came about? Why Ahafo, Asutifi North? Why that place? Why not Kumasi? Why not Accra? It would have been easier. And what did they do to be able to bring all these people who for years have been working apart and not so eye to eye, bringing them together to create this situation? So I'll invite Honorable Regional Minister, tell us what happened, your vision. And then we'll go to your IRC to tell us why Ahafo, Asutifi North, and why this process. Thank you very much.
Thank you, Doctor. Good afternoon to ladies and gentlemen who are gathered here this afternoon. Looking at the brief introduction from Doctor, our story has already been told. So it's just a matter of maybe emphasizing some of the things that he has said already. But I think it will be more convenient being the representative of the president in the region to extend greetings from the president to all of us gathered here, especially those who are not from Ghana. So greetings from the President of the Republic, Nana Dankwa, His Excellency, Nana Dankwa Akufo-Addo. And also greetings from the good people of Ahafo, the chiefs and all citizens of Ahafo, to all of you gathered here, especially the non-Africans amongst us. I'm very sure by the end of it all, you appreciate what our development partners, in conjunction with the local actors, have been able to do for the good people of Ahafo. Briefly, I want to take you through the governance structure in Ghana. By the 1992 Constitution, the local government minister has the duty to divide the country into governable structures. That is what you call the districts and the regions. And these districts that have been created, the core objective of this district is to ensure adequate development of the various districts that have been assigned to specific group of actors. And in each of these districts, at the helm of affairs is the district chief executive, who is supposed to be the pilot, who is supposed to be the captain to steer the affairs of development in the various parts of the district, with each district coming together to form a region. And in the case of Ahafo, we have 6 districts. 3 are municipal districts and 3 are ordinary districts. When you talk of municipal districts, it constitutes places where population is more than 95,000. And when we say a place is a district, population is about 75,000. So you have 3 municipals and 3 assemblies. And before you can embark on any key development, you must appreciate and then know your major challenge. And in Ahafo, our major challenge has to do with provision of water and then sanitation. This has been our major challenge. So we decided to look all around, to pull all resources together, to get all people together to be able to confront this problem. So in our attempt to do this, you were able to get a lot of these non-governmental organizations, our various groups in the various parts of the region together to be able to confront this problem and then resolve it once and for all. And in doing this, we decided to use a strategy. And the strategy we used was that, why not put all the resources together and then use one district as a test case, after which we can replicate whatever will come out of it to all other areas. This is how come we decided to use Asutifi North as a test case. And from what Doctor has said, the results that have come out has been very, very encouraging. Because looking at a population of about 84,000, and if as at now, 64,000 of them has access to good drinking water and good sanitation practices, it shows how this strategy has been able to bring up such a very pleasant results. And when the program that was going on in Asutifi North, at the top of it was the regional administration. And the duty of the regional administration was to coordinate and then supervise the activities that were going on in Asutifi South. So from the success story of Asutifi South, you have to appreciate the good work of IRC, Necentric, Latter-day Saints, and a host of other non-governmental organizations who came in to assist in achieving such a feat. So as at now, Asutifi North has become a hero so far as WASH programs are concerned in Ghana and for that matter in Africa. Because the district chief executive of Asutifi North has been going all around the continent of Africa, proclaiming the good news. And what actually helped them to be able to achieve what they have been able to achieve. So management of the region sat down and then said, if this is what has happened, then there's a need to scale up to all the other districts. So whilst you are talking about this, trying to fashion out ways and means of getting assistance to be able to scale up these things, IRC came to our aid. So with IRC coming to our aid, they were able to, through a certain criteria that was developed by them, come out of the remaining 5 districts to select 3. And these 3 were also assisted by Hilton Foundation to be able to draw their master plans. The master plans have been completed, and tentatively, we have decided that between 14th and 15th of November, you launch this for the activities to begin. And then apart from that, we have 2 other districts that are not part of the program, the WASH program. And through Hilton, we have also been able to get funding to be able to help them to also draw their master plans. So they are in the process of drawing their master plans. So if they finish drawing their master plans and we rope them in, it will mean that all the 6 administrative districts are on the WASH program, and the whole region would have been covered. So that is our vision. And I'm very sure that within a very short time, you'll be able to get these 2 districts in addition to the others who are on the program already. So these 2 districts are North South and then Asutifi South. And I hope by the end of this year or early part of next year, they would have finished their master plans and they would have been roped onto the program. And when all these things happen, then when you come to Ahafo, you will see a decent society. You see a society you love to belong to. And you see a society where all people have come together to make that place very peaceful, very healthy, and where everybody will want to come and then work. Apart from that, we also have a lot of investment opportunities. So we are doing all these things in anticipation of getting a lot of people to come to Ahafo to invest. Be it mining, you have a lot of mining deposits in Ahafo. Be it tourism, you have a lot of tourism facilities in Ahafo. Be it agriculture, you have a lot of plantain. As at now, they are getting rotten because we don't have facilities to add value to them. So we invite a lot of people to come to Ahafo and then invest in these areas. Agro processing, everything. Timber, all the timber trees we are seeing here are small size timber trees. You come and see big timber trees in Ahafo. So if you want to invest in plywood, if you want to invest in furniture, you come to Ahafo. Because the foundation has been well laid. The environment is gradually become healthy and it will be healthy. So this is Ahafo for you. Thank you very much.
Thank you, Honorable Regional Minister. Thank you very much. And you know, it's not just about water, because where Ahafo is within the country, it was noted to be one of the areas where when they send teachers there, they don't go. Because they want, you know, they wouldn't have access to good water. So why should I go there and risk my children? Today, people go and make that a first choice because they want to be in Ahafo. Why? Because they will have access to water and sanitation, whilst those in the urban areas are still struggling. In my house in Accra, I get access to water once a week. So the other days, I have to find a means of accessing water. If you go to Ahafo, it's 7 days a week. Why wouldn't I go there? So it's not just initiating one facility, but it's a whole changing process that we've set up in those areas. Thank you very much, Regional Minister. Thank you so much. Good. Now we'll go to IRC to tell us why Ahafo. There's so many places. And then what do you think beyond that? What else can we look forward to? Good. And how did you do it? Bringing all these people together, community and others. Thank you. So take some 5 minutes if you
Yes,
can. Because,
yes. Thank you very much, Doc, for the opportunity, and good afternoon to all of you. I think a very good and solid foundation has already been laid by our moderator and, of course, our able regional minister by walking us through the key pillars and planks of the work that we've done. So I think my work has been made very easy. I'll just go through. We have a few slides I wanted to share. Okay. So I think the critical entry point for our work in Ahafo, specifically as Association of Districts, was to begin with a long-term WASH master plan, to try and bring together all the key critical stakeholders to co-create and develop this plan, which represents the collective vision of addressing universal access to water, sanitation, and hygiene services. And clearly, there was a good groundswell for why we should have this long-term plan in place. And basically, this was the process that we went through to be able to launch that district-based process of demonstrating how we can achieve SDG 6 at the local level. So the whole process began in 2017, where we built the partnerships, brought together all the different stakeholders from government, private sector, CSOs, and what have you, to co-create that common vision for delivering WASH services in the district. 2018, we launched this master plan at a colorful event and then kickstarted the process of mobilizing resources. And then in 2019, we began the process of investment. That was where the actual infrastructure development began. And of course, all these processes supported by the Hilton Foundation and the generous investment from the Association of District Assembly. And since 2020, we have been going through this process. For some of you who are interested, it was a very elaborate planning process. It took us a year to be able to come together, to be able to prepare these plans. We have copies of these plans that we can show you. So this is the vision for the ANAM initiative. And what we are saying is that every person in the district by 2030 will have access to sustainable water, sanitation, and hygiene services. Association of currently has a population from the 2021 population census. They have a population of 73,000, but it's projected to grow to 84,000 by the year 2030. The targets we have is by 2030, like the moderator indicated, everybody will have access. But we also recognize that it's not everybody who can have access to safely managed water services. So given the different dynamics in the district, we believe that 30% can have access to safely managed water services, and then the rest will have access to basic water services. I also think for sanitation, 38%, 62% for access. And for WASH in healthcare facilities and schools, we are looking at having 100% access. We've also been tracking the investments that have been made so far in WASH delivery in the districts. And you can see the disaggregation of the cost. If you look at water in particular, capital expenditure, we've spent almost $1 million US in providing the infrastructure. And what is required is 1.4 million to be able to provide the infrastructure from 2018 to 2030. That is the target. And so far, we are doing almost $1 million, looking at what the partners have invested in with support from the Hilton Foundation and what the district has also put in. So this is the partnership. It's a very solid partnership that is behind this whole process. And we are all committed to the plan, and we are joining forces to be able to drive the delivery. So you have the district, you have IRC, you have Safe Water, many of them are here. And I'm sure at some point they will also speak to the specifics. So there are some of them who are doing infrastructure Others are doing system strengthening like IRC, also have World Vision, Save Water, who are in the infrastructure, CDC, who helped us to do the assessment of wash in schools. And the central campaigns building the ANAM network to be able to connect the ordinary citizens with the duty bearers, of course, easy water for everyone and acquire. This is some of the infrastructure that has been developed. I'm sure for small communities and also for small towns. We also have some of the infrastructure that we have in the schools. And you can see the permanent hand washing stations and then the solar powered systems. Then, of course, we also have the ANAM wash desk that has been established. I'm sure Ben and Marty can speak more to that, but it's such an innovation of being able to mobilize ordinary citizens to support the implementation of this wash master plan. And the ANAM network allows us to be able to connect with these ordinary citizens when they have complaints, they have issues, they know where they can channel these concerns and issues to. Of course, we also have water quality testing by some of our partners who have been supporting the districts to have a framework in place to ensure that the water that is delivered to the people meets the required water quality standards. Of course, in all of this, like Minister indicated, you need a hub organization to be able to drive this process. You need an institution that can galvanize all the different stakeholders and the partners behind this common vision. And that is what IRC brings to this whole ANAM initiative that we are talking about in guiding the process to have the plan, the monitoring, the learning, and what have you. So this is spatial distribution of how the facilities are distributed across the district. And we also have an elaborate monitoring system in the district that helps us to have a shared measurement process and to collectively account for our progress. So you can see that from 2017, where the unserved population was around 18%, we have reduced that to 10%. Look at safely managed, we started off with 5%. We have been able to increase that to 15%. So it shows you the incremental progress that we are making. And for sanitation, we have also seen quite a lot of progress from 2018. Open defecation was around 3%. It increased to 7%. By the last round of monitoring in 2022, we were able to eliminate that. And you even see some improvements in safely managed access to sanitation services. But the greater proportion of the people rely on shared facilities. And that is not very surprising. For washing schools, we've also done quite well for water services till 2018. And then as we speak now, all our healthcare facilities in Ashanti North District have access to basic water service. For sanitation, we are around 50%, and we are still working towards ensuring we can achieve 100%. For hygiene services, we've seen improvements from 29 right up to 75% of our healthcare facilities that have. And the story for schools is also not different. We've seen improvements from 2018 to 2022 in terms of access to water services. For sanitation, we've also seen good improvements from 34 to 55. And then for hygiene services, something dramatic happened. In COVID, we saw huge improvements, but after that, what we are seeing is that some of the hand hygiene facilities are non-functional. Some of them, they are broken, the taps are broken, there's no soap and what have you. So it's something that we have to quickly think of how we can address that. So with all the lessons, we have identified key pathways for scaling. So we have regional replication. We are also institutionalizing the lessons through the National Development Planning Commission. And we are also seeing some of our partners who have worked in Asutifi also institutionalizing the new ideas, the good ways of working, the best wash practices also into their own organizational work. So at the regional level, like we indicated, 3 more districts have been included. Yes, he told us that story. So these are the 3 plans that we have prepared and published for the 3 districts. So Ahafo North, we have Ahafo South, and then we have Tano North. We have copies here that we can show you. And thankfully, the Director General is here, whom we've been working with closely to also achieve the national level institutionalization. There's definitely no better person to speak to that than he himself. Some of the success enablers, what have been the things that have helped us to achieve this good story? Leadership is definitely critical, and you can see that demonstrated by Minister and all the other district chief executives that we are working with. Community support has also been good. Financial commitment, we have seen a lot of the districts investing heavily in water, sanitation, and hygiene services. I've also seen a donor that is committed in walking this long journey with us, and that's the Conrad Hilton Foundation. It's very, very, very important. They are committed to working with us through this journey till 2030. And you need that really to be able to get the kinds of results that we need. And of course, I've spoken about this, the critical role also of IRC to drive this particular process, and our regular monitoring and review meetings is also something that is helping to bind the partnership together and help us to all pull in one direction. Of course, working in partnerships doesn't come easy. It's quite challenging, it's difficult, but of course, we were able to work through the process to achieve the kind of partnership that we have in our Citizen of district. But it took us some time and took us a lot of effort to be able to achieve that. Definitely, we still have issues around raising enough funding to support the master plan. We don't have all the resources. We are still on the outreach to mobilize more resources to support this particular process. Sanitation is still a challenge to be able to bring in the required private sector support and also get a lot of CSOs to support in that area. Many of the partners I've spoken about are operating within the water sector. And we think that we need to do more to be able to bring a lot more investment and partnership into sanitation. I will conclude by saying that to be able to achieve this critically and replicate in other areas, one of the fundamental things that we need is partnership. Because if you look at the scale of the challenge in the water sector, no one individual organization or government can achieve that. We all need to work together, pool our resources and our capacities together to be able to go faster, because we just have 7 years to 2030. And if we don't work together and pool our resources together, we may not be able to achieve that. And we need government leadership to be able to drive this particular process. And of course, everybody working towards that common vision. And we think that our master plans represents that common vision that everybody can refer to and can see what the blueprint is for achieving our end goal. All our 4 master plans are on the web. The links have been provided. If you want to be able to download any of these master plans, the links are available. Thank you very much.
Thank you very much. So what we will do is to also give the chance to our partners to, so we have 4 chairs here. Let me first invite Safe Water, World Vision, Acquire, Eccentric, and then we'll go through. I think we can add 2 chairs to invite CDC. Yes. It's not here. Okay, then that fits it. So Eccentric, Safe Water, Easy Water, yes.
Okay.
We have only 15 minutes, please. 15 minutes, 15 minutes. So let me start from Safe Water once Joe seated first. And the question is, the biggest problem of people in Ghana is paying for water. And joining a process which was very, very risky in a rural area where water can be fetched from the ground. And when it rains, it becomes even a buffer. And then you decide to go there and risk in testing, investing in this facility, and being convinced that, yes, the people could pay and manage it themselves. So that's my question. What moved you? And so far, how do you see it? Success or otherwise?
Okay, thank you very much. Yes,
So let me give you 3 minutes so that we can share it.
yes, I agree that we have had challenges when it comes to sustaining water service. One of the key driving factors for us as non-state service providers was the leadership shown by the political authority. We had evidence that there was some indication that at least a segment of the market were already paying for some water services, although it wasn't up to what the market requirements will satisfy, but at least there was some evidence that there was a culture of paying for water services. If you look at the district capital selected communities, there was also evidence of investment by the local government authority. And for us as non-state service providers, we admit that we cannot bear the full capital cost. So one of the prerequisites for us was the willingness and ability of the local government authority to commit financial resources to the investment that we are going to put into delivering water services. And if that will happen, then it means they need to dig into their coffers, and rightly so, they were able to demonstrate that. So I think the district political leadership, the fact that there was evidence of people already paying for some water services, was enough an attractive proposition for us as non-state service providers to go in and deliver that service. And I must say that the experience from that initiative for us has been a huge success. For the first time, we've had one district where all the capex or the investment that we've made, as much as about 50% of the capex was provided by the district assembly. And that is remarkable because we haven't had that experience in any other parts of the country. And it's been one model that we've always been showcasing to other local government authorities, that it is not enough for you to say that you are committed to providing water services. You need to be able to prove it. And the best way of proving it is having a skin in the game. And I think that is what the Executive North District Assembly has been able to do. We've always said that for us as non-state service providers, we are not there to provide a service. We acknowledge that it is a role of government. We are only demonstrating how that can be done and how that then can be scaled. And for us, the example from Executive North clearly demonstrates that this is a service where government can put in its investment. And what we've noticed is once the district assembly puts in money, they become interested in the day-to-day management of the water services. As I speak, I have had a lot of emails, WhatsApp messages from the district assembly asking for updates on how their water service is running. This would not have been the case if they had no money in it. In fact, the only time they'll reach out to you is when the service is not running, then they are telling you, what can we do to fix it? But this time around, once they have money in it, I bet you that even if the tap does not run for 1 hour, they are going to call you to ask you because they have an investment in it. And for us, that is a perfect pathway for scaling up our initiative, especially at the community and then at the district level. It's been a huge success for us. We have benefited also from the interest and perspective from other Hilton Grattan partners who are also actively working within the same geography with us. We admit that we cannot satisfy the needs of the entire market. And the assembly, of course, helped us with the plan. Within that, we are able to determine which market segment we can go in. We are able to estimate what the need is and then plan our investment. So it can only be better. And I think so far it's been good for us. Yeah. Thank you.
In fact, this is a proof to the whole country that where you are able to convince the district, they will definitely invest in it and show interest. And we're very sure that we're not going to have a system which is not working, come another time. This is good. One of the things we also identified with this program at Executive North had to do with engagement with the community, with the people. And the magic wand was wielded by Eccentric. How did they do it? And what shows that if one day Eccentric is not there, this will continue.
Thank you. So at NetCentric Campaigns, we believe in building a network of people to drive social change. This principle also aligns with the common proverb in Africa that if you want to go far, you go together. How did we do all of this? When the district master plans were launched, one of the key phrases is that they want to build a stakeholder-focused network to address what was referred to yesterday in the plenary as wicked problems in the sector. And what are these wicked problems? Non-payment of tariff, high rates of leakages, poor accountability of water system managers, and weak connections between system users and service providers and the regulators. So we know that the network that is supposed to address these problems has to be created, and that is where we come in. We started with what we call the rapid network assessment. Essentially, we looked at the water landscape. Who are the stakeholders that are doing what in the sector? What are the existing channels of communication, and what new channels can we introduce? What kind of resources do individuals have, and what kind of resources do they need to do the kind of things that they want to do? So with all of this information and working together with the district, we identify who should be leaders in the network, what should be the communication grid, different ways of talking to people, existing channels like community information centers, like radio station, and then we introduce new ones. We have a toll-free number, we have WhatsApp groups, we use Facebook, we have radio. So all of these channels put together help us to have this constant engagement. There is a two-way communication between water users and the regulators. Essentially what happens is we have a watch desk that uses the toll-free number. If people have issues, let's say water quality issues are bad, or there is a leakage somewhere, or community members are not accounting for the water they use, they call this number. All of those complaints are collated. We have an advisory group at the district level that looks into the complaints, and that is where the calls go to people like Safe Water, that we are having issues, or we notice a change in the quality of water, or we notice that there's a reduction in the pressure of the water that we are receiving. What do we do? So this two-way interaction ensures that all of the different stakeholders and actors that have different roles to play are constantly engaged. They have their ears on the ground. They are listening to what is coming through. We communicate on daily basis through our community information centers, on weekly basis through the SMS that we shared, and on monthly basis through the radio programs that we have. So all of these different channels help us to keep pulse on what people are thinking, what they feel should be done differently, and how they want the systems to operate. So we have this feedback going to regulators, going to the different donors, and also to the various community leaders. So essentially, that is how we have built a network. Currently, we have over 8,000 people that we engage with on regular basis. The goal is to reach 10,000 and keep growing. We are not only interested in having the numbers, we are interested in keeping the network members active. So recently, one of the network members wanted to do a cleanup campaign in one of the sub-districts. So what we did was to broadcast this information on the platforms that we have, and that brought other people to support. So that is one way of sharing resources within the network. There are ways that we engage. If you have a borehole that is broken down and you have an area mechanic that has worked on it previously, that information is publicized. If you have similar case, then you know who to talk to. We have enhanced wash literacy. People know that WSMTs or water managers are supposed to account to them on regular basis. And on the basis of that, they bring in complaints. Our WSMT has not been accounting, and then that is referred to the district, and then the district takes action to make sure that either the WSMT accounts or a new WSMT is reconstituted. So all of these different channels
Thank you.
help us. Thank you.
Thank you very much. I remember one time I came to the City North, Kenya, and they had a time that they were going for mass. I'm a Catholic, so I decided to go to church. When I went in there, the place was empty. And I told the priest why. He So they had to change the time for the mass because it coincided with the water hour. People had to go to the radio and listen and have discussions on water hour. So they changed their mass time. So wow. So this is it. Where the people want to bring a change, they can. And this is a very good example of that. Finally, we were challenged during the planning time that community water and sanitation says that, look, beyond a certain population, we cannot serve. If you don't have a community more than 75 people, we cannot provide anything for you. You cannot have access to water and sanitation. So this was a big challenge for us. How do we get to these people? Because this is a place where there are farming hamlets scattered all over. But one institution said, we can. And that is Easy Water. So we'll listen to you now. How did you make it?
All right. So we joined the network quite lately. We were working in other districts where it was difficult to get the assemblies to buy in. So when we got in touch with IRC, they told us what they were doing in the Sutifi and the fact that there was already a master plan. They also had data on communities that were available and the number of people that were there, what the water sources were. And we thought it was good for us to go in there. In fact, when we went into these communities, we decided to increase our cost of capex by almost 40% because initially we were doing gasoline pumps, but when we went in and saw that the communities were ready to pay for the service that we're providing, we decided to go into solar. So currently we've done one solar setup. We have one gasoline, checking how the consumption is, what the payment model also is. We have also gone into set an account for each community. So we're working with a microfinance within the district, created an account for the community so that they decide how they pay for the service that we provide. So based on these analyses, we know how to expand into the remaining communities, especially with the scaling up into other districts. We know what model to use. So for us, it's as the ANAM project or the master plan gives us the opportunity for us to work in the space that we are comfortable in, which is the last mile community, whilst the bigger organizations also deal with the large numbers, because our strength is a technology that serves communities that are in hard to reach areas and provides water that is easily accessible. Yeah.
Thank you very much. So we did not leave anybody behind. And that is very, very important. Okay, so let me say that Aqua Institute is not here, but they also worked on the quality of the water to make sure that there's good quality water reaching them. We discussed the issue of lead, for the last 3 days. And this is where they also look at and make sure that it is good. World Vision is also not here, and they also provided a lot of facilities for some of the rural areas, borehole and other things, and good borehole, not the one which is prone to lead. And this one, they make sure they go through the examination and make sure it's a good quality one. So that is it. But the story is that in the institution which I head, the National Development Planning Commission, we rank districts every year in terms of water and sanitation, health, education, access to energy, access to ICT, and access to security. And the first time we did that, which included a certificate on WASH, out of the 261 districts in the country, there were 161st. So 161 over 261. And that was 2020. We did the same thing in 2002, 2022, 2022, 2 years. From 161st, they came to 606 in 2 years. And that tells you the magic of this project. So everybody was inquiring, why this district? And I have been closely linked to the project, so I knew why. But a lot of the consultants who worked on it, and these are University of Ghana consultancy firm over there, so they didn't know anything about the background. But all that they did from the survey was that they were assessed from 161st. So it can work. And this is what the regional minister said, they are bringing it to the other areas of the country. But we cannot end without hearing a word from the Conrad Hilton Foundation. We heard the name mentioned several times when we're wallowing and going up and down, looking for somebody to get this stretch so that we can really attain the vision. They said, here we are. So Nabil, thank you very much.
Yeah, thank you. So His Excellency, the regional minister, told you about all the great things you can do in Ahafo, but he didn't mention that if you want to eat the best jollof rice in Ghana, go to Ahafo. So, no, thank you so much, and please allow me to just take a minute to really thank our partners, the government of Ghana, all the partners, all the government officials present with us today, from the ministry, from the NDPC, the region, local governments, CWSA, everyone. Thank you so much. We really are grateful and appreciate your partnership. Thank you to all our partners. I'm not going to name them. You saw them on the slide because I'm afraid I'll forget someone. So thank you so much. We are really proud of this work, especially the replication and expansion of this work. And Jerry and all the colleagues mentioned that, so I will not repeat all this. But I want to just mention something very important related to these master plans. What's really important, it was developed by people who are using water services and who are using safe water, and they all had a say and they worked with their representatives. So this is something that's really important. But the other point to highlight is that this is a costed plan, which is not only a wish list, but there are numbers and amounts and dollar signs or cedi signs associated with actions, which really makes it a very important and useful tool for the government to advance safe water, safe water, sanitation, and hygiene in this case. So I think we got a very good overview. I just want to zoom on something important, looking forward to the continuation of this work. One aspect that is really important is to keep scaling up and replicating this approach, but also to integrate all the learning that we have accumulated over the years, working first in Asutifi North and then expanding into 3 additional districts in the Ahafo region, and hopefully with the partnership to continue and cover the entire Ahafo region. One very important aspect in this replication is to really look at operation and maintenance, because an important learning is that infrastructure alone is not going to solve the problem. We can drill all the boreholes that we want, and this is easy because we have plenty of qualified engineers, but this is not going to bring safe, clean water to people to drink and use without having an impact on their health. So the important point is to really look at how we can deliver safe, professional, reliable, continuous, sustainable, and affordable services to people. And each one of these words takes a lot of work and efforts. And this is why it's really important that this plan looks like a puzzle, and all the dimensions are included, with the communication and customer services, with the operation and maintenance, with definitely the infrastructure, with the role of the government, with the role of water quality, et cetera, et cetera. So all these elements come together. So this is one point that is really important to note. And the other point is that because of the way we work at the foundation, we believe in an approach where our role is to empower the institutions that are mandated by law to provide these services. And those institutions are all Ghana government institutions, and they are present with us in the room today. So because of this philosophy and because of this approach, we are really committed to supporting the government of Ghana to anchor this approach within the government system, within the local system, because we have limited resources. All of us have limited resources, and none of us except the government is mandated to scale this approach, and if it works and if the government is comfortable with it, to really implement it at the national level within all the districts and the regions in Ghana. So this is another important point that we really wanted to emphasize today. And again, we greatly appreciate your partnership, and we hope that we can continue working on this together and learn and support you with this approach. And with this, I will thank you very much for the opportunity, and I will pass on over to you. Thank you so much.
Thank you, Nabil. Thank you so much. I could hear the voices outside, so they might be calling us, but we really appreciate this. For National Development Planning Commission, we're taking it from here, and we've already made the promise that it would never end with just one region and 6 districts. We've made it part of the medium-term development plan, and in prioritizing our targets for the SDGs, we said that definitely SDG 6.1 and 6.2, we're going to achieve that as a country. And that should be the first that we should hit because of this process, having a master plan, and all the districts are calling. NDPC, can you support us to develop the water master plan? Can you do that? MPs are coming to us just because of this. And we hope that we'll be able to accomplish that. So we thank you and have an evening, but be thinking about Ghana, be thinking about the Sutifi and the success there. Talk to people so that we can continue to mobilize more resources to reach more districts, and then also the government to play its role. We are committed to it. Thank you very much. Thank you. Copies of the plans are here. Oh. Yes. It's on the website, but the copies are here. If you still have space in your baggage, you can pick a copy. Okay. Okay. Yes, that's another session. Yes. Okay. Yeah. Let's do it quickly. Jerry. Nabil.
Please join us.
Time. Okay.
I'm here.
Martin.
Joe.
Yeah, thank you. Thank you. Okay.
You're welcome. Come back next year to do better. And Carl, staying out of trouble.